I became a mental health first aider 3 years ago, and during that course we was asked to listen non-judgmentally. And so after the first day I went back to my hotel room and I thought, how could I listen to somebody non-judgmentally about mental health if I didn't fully understand my own mental health and where I was? So I started to write down on a bit of paper everything that had happened to me mentally, physically and emotionally over the past, say, 5 years. And wow, what an eye-opener that was for me. I found myself sobbing my heart out on page 2. At the time of becoming a mental health first aider, I was a project manager within the construction industry, covering some high-profile projects which are very demanding, resulting in a lot of pressure, stress, responsibility. And I think I found myself, that stress and pressure was the mask, hiding all my other issues and emotions from my home life. The first thing I started to do differently was to talk more about my emotions and feelings, especially at the weekends after working away from home, and not find myself wanting to get back to work to hide from it. So I talk more about it, and also I talk more at work about my home life rather than work at home. No medical help as such. Occ health we had at work anyway, but I found more relief and comfort by talking to friends and especially family. I think with the construction industry being such a masculine sort of an environment, I think, yeah, that is big. I don't want to talk about it. It's embarrassing for some people. Some people find it very embarrassing to talk about emotions and even crying. There's no harm in doing that. If I was to go back into that position as a project manager in the construction industry, I would let go of my emotions a lot quicker. I manage my emotions now differently, in the aspect that I'm not ashamed. If I get tearful and emotional, I watch promotion videos, etc. Yeah, they will bring a tear to my eye, and I don't care what people are thinking. I'm a human being and I've got emotions. I think that's one thing we all have in common. We all have emotions. I talk more, so I encourage people to talk more about their feelings, because it definitely helped me realise that I was probably that close to breaking. I never sought medical advice, so I was never diagnosed with a condition. It was a bit of a self-diagnose and self-remedy to encourage myself to think, hang on, I need to do something about it, I need to change. And I think if I hadn't have made that change, then who knows, it could have been a lot more worse.